What's going on, Ranger Challenge? This is Cadet Winchell with your CBRN care. Um, so your given scenario, at least on the sheet that was given to me, was your battle has a head injury in a CBRN environment. Just like any other medical case or any casualty incident, safety is most important. But in a CBRN environment, you got to really take into account the safety of yourself as well and the safety of your other battles, because I'm going to give you some buzzwords to use, at least when you're putting in this situation. Contamination. Contamination's big, and cross contamination. So if you're in that CBRN environment, there's vapor, they touch the chemical, whatever it may be, you need to keep that with them until they get cleaned and treated, and not give it to yourself or another battle. So be very cognizant of what you're touching, where you're touching, and then some more buzzwords would be your, signs and symptoms. With your signs and symptoms, what's happening? Are they unconscious? Are they nauseous? Are they responsive whatsoever? Is their mask off their face? Is their J list ripped? A lot of the signs and symptoms can be shown simply on some cheat sheet cards. I'll be sending out something that y'all can look at to show the layout of some of the things I'm discussing, as well as a list of signs and symptoms and some of their preventative equipment that's supposed to help treat. So getting into that equipment, you have your Atnas, right? If anybody has any bee allergies, it's very similar to an EpiPen. It'll stab right through clothing. You administer it the same way, right into the thigh. Remember, in the CBRN environment, you're treating yourself before you're treating your battle, because that, if you're touching them and moving them, that now you're opening the door for that cross contamination. Now, if you start touching them and moving them, and you didn't administer an Atna to yourself, you don't have anything to block that nerve agent from hitting you. So make sure before you're touching your battles, and you looked at the signs and symptoms, and you're like, hey, shit, this might be a nerve agent, it's best off to hit yourself before you start working with them. That way, if anything is open on your suit and you can't tell, now you're cross-contaminated, and now you're exposed yourself. I don't think they're gonna. I was talking with Spino. I'm not sure if they're gonna be playing stump the chump. This is kind of a stump the chump, just with a few words of a head injury in a CBRN environment, because they're kind of screwed. If there's not an established decon line or an evac position, anyways, it's tough. An exposed wound opens up everything for the chemical to come in, especially if it's a vapor. If it's a very viscous liquid that they touched, it's going to hang around for a while until it dissipates. So that head injury, I mean, your main goal is to get them where they can get cleaned up and they can be treated. You're not going to be able to do anything really on the spot, because everything that you're using, you're exposing to the air, which is contaminated, especially if you're both wearing masks and you had the information that was contamination. Now, going back to communication, you see the head injury, you need to report who you are, where you are, and the mechanism of injury. So that way they can prep at the decon line to clean the patient, to take care of the patient, and get them where they need to go, hopefully, if they're still living. But y'all need to really, when you go into any kind of CBRN environment, is take that step back. And like I said, you're the most important thing, because if you're contaminated, there's nobody to treat them. And then now there's two bodies that need to be deconned and lifted out. So just take your time with everything. Don't touch too much. Make sure you kind of give it the full 360 around. It's not the care under fire where you're dragging them to safety and then treating them, because like I said, that cross-contamination is huge. It's huge in the CBRN world. I will go over quick maybe some equipment you're provided. A JCAD stands for Joint Chemical Agent Detector, or JCAD. It's got a nozzle on the top. There's an inlet and an outlet port. That'll pick up a lot of your vapors, and if you get it close enough to like a puddle of some sort, or even a drop, as long as that is creating some kind of vapor off-gassing, as we call it, that'll trigger your JCAD and let you know that there's something in the air, and that needs to be called back as well. So those three important things: who you are, where you are, mechanism of injury, and what you're seeing. Because I'll give you another situation that maybe they'll put you in. If you're wearing J-list, as Spino would know, you put J-list on, there's M9 tape, usually around your bicep. your wrist and where you blouse your boots. Some people put it on their chest and other areas where you can, maybe if you're walking through something, they can pick it up. But if they put M9 tape and the M9 tape is any other color than that white that it's supposed to be, you need to look at your indicator card. And usually red's bad. Red's very bad. That should be called back as well. So you're trying to get as much information as you can in the position that you are without doing cross contamination to provide to the decon line and the medical personnel that are there waiting to treat the person. That's kind of as far as I'm going to go with it. If you guys have any further questions, I'm going to send out some material. Feel free to reach out to me. If you want to run through some scenarios, I'm more than happy to do a Zoom. I know it's kind of hard because you tend to, when you get too into this stuff, you're speaking a different language. So if I had a bunch of questions and stuff, it's easier for me to respond to you guys as you want to ask those. So that's all from me. I look forward to maybe helping you guys out with some more stuff. So enjoy your holiday break and Merry Christmas.